Today, we're going to talk about a form of cancer that is widespread here in our country and around the world, lung cancer. According to global statistics, lung cancer was the second most diagnosed cancer with the highest mortality worldwide in 2020. Not only that, the trend of lung cancer is very much the same in the Philippines.
Just like the global statistics, lung cancer is also the second most often diagnosed cancer and similarly is the leading cause of cancer deaths among Filipinos. As your partner in respiratory health, the Lung Center of the Philippines wants to make sure, okay ka lungs.
Join us in this important discussion and find out if it's time to consider taking the Screening for Early Lung Cancer Detection and Treatment or the CELCAD program. Cancer screening saves lives.
In fact, it is recommended that a cancer screening test be done to detect lung cancer at its early stage so that treatment may work better. Early intervention helps reduce the risk of cancer-related death by 20%. Sadly, only 7.5% to 13% of lung cancer is diagnosed at stage 1, which is the early stage, and a huge 60% diagnosed at stage 3 or 4, which is already at the late phase of the disease when treatment may no longer be as effective.
For this reason, a screening test for lung cancer is recommended for people who are at high risk. Who are these individuals? All people between 50 and 80 years old with a smoking history of equal to or greater than 20 pack years and either continuing to smoke or have quit within the past 15 years. First-degree relatives of non-smokers who have lung cancer, parents, siblings, and children of non-smokers are at higher risk of developing lung cancer.
Aside from smoking and family history, other risk factors include exposure to secondhand smoke, asbestos, radiation, and other carcinogens. The screening test for lung cancer is called a low-dose CT scan for the chest. Some of you may be wondering, can I just do an X-ray instead of a CT scan? A low-dose CT scan is the only recommended screening test for lung cancer and not an X-ray. This is because approximately 90% of lung cancer cases are overlooked or undetected via chest X-ray.
So to make sure you get accurate results on your screening, a low-dose CT scan is best.
At the Lung Center of the Philippines, the Department of Radiology uses the state-of-the-art Siemens Somatom Go.Now CT scan machine for lung cancer screening. Compared to a conventional CT scan, this low-dose CT scan uses about 5 times less radiation, so there is no risk of radiation overexposure. It is a non-invasive procedure, takes only 1 to 5 minutes, and is painless. There is no preparation needed, no injections, no contrast or dye, and no medicines to swallow.
The CT scan machine used by the Lung Center of the Philippines produces exceptional lung images with minimal artifacts or image degradation. In addition, the artificial intelligence-driven software, lung nodule CAD or computer-aided detection program, assists the radiologists in identifying solid pulmonary nodules during the review of CT examinations of the chest.
Oras na para siguraduhin okay ka lungs with the Screening for Early Lung Cancer Detection and Treatment program.
The Lung Center of the Philippines gives you the power of early detection for early treatment. If you or anyone you know is at high risk, go for early cancer detection and treatment.
It could save your life and the lives of your loved ones.
Scan this QR code for a lung screening test and consult your doctor today.